Hi guys, welcome back to Strength Stories with Jore. Today we have on returning guest Landon Horst. Landon, welcome to the show.
Thanks for having me.
So I wanted to bring you on since obviously GLP-1s have been a pretty popular topic right now. Since you deal with that in your role in weight management, just kind of discuss how you guys address that and some of the pros and cons you've seen in working with it.
Well, yeah, so it's just something that's becoming so much more popular now. And, you know, what we've seen is just that they're being prescribed so widely, but not always that the nutrition kind of recommendations or things like that are coming with them. And so, you know, at least like the program that I do, we kind of specialize in that almost. Not that everybody's on one, but, you know, several people are. And, you know, some of the stuff I've prepared today is just kind of like common mistakes that I see, and then some must-dos is what I wrote.
Perfect. Yeah, so how would you say that's increased in terms of like, obviously they've been on the market for the most part of like 3 or 4 years. Is it probably been the last year that you've seen the most of it, or?
Yeah, I would say the last 2 years probably, and you know a lot of it's related to the insurance coverage kind of expanding on that. But yeah, we do see, you know, obviously the ads are everywhere, so people are coming in kind of looking for that specifically.
Mm-hmm. And so when someone comes to work with you in weight management, have they already been prescribed it by a doctor, or are they coming to you looking to add that?
I would say it's about a 50-50 split there. A lot of people that come in are already on one that was maybe prescribed by their primary care or, you know, maybe through a compound pharmacy. And then some people are coming to our program kind of specifically wanting that as part of the treatment plan.
Mm-hmm. Again, I would love to hear kind of some of your considerations on that of what are one of the main things that you're looking for as like a kind of a green flag for people using them versus like red flags or potential issues when they're incorporating it?
One thing that I think is really important is just making some changes before you get on the medication, you know? And I don't always have say over that or control, and especially if someone comes to the program and they're already on one. But I really think it is important, you know, and that's kind of what I'm going to go into, is that you're actually establishing good habits and not just using the medication. And if you don't do any of it without the medication, sometimes it's hard to know what that's going to feel like or kind of how to navigate it.
Yeah, I saw a post from a guy the other day who's saying that regardless of whether you're using a GLP-1 or not, you're still going to ultimately need to strength train. You're still going to ultimately need to eat protein. It can be very much a helpful adjunct, but it's not the sole replacement for everything.
And one thing it does do is make some of those things easier to do, you know, and a lot of people that have trouble with overeating or binge eating or things like that are getting some relief with the medication. And that's great. But like you said, it only really is going to work long term if they're also, you know, adding those other things.
So when you say, I think one of the issues I think I've heard from a lot of people is just not being able to even get the protein because they don't have an appetite or something. Would you say, is that a common thing for people to be struggling with not even having enough appetite anymore, or is that more of a dosage issue?
Well, that kind of ties into two of my common mistakes here. But so I'm just going to start at the top because it will tie into that. But one of the most common things I see is people just skipping meals or not eating or doing one meal per day. And the problem there is that a lot of people think that's like best case scenario. They're
getting faster progress.
Yeah, they're really pleased with it. You know, they're like, oh, it's awesome. I don't have to eat anymore. And as much as I'm like, that's great that you don't feel like this constant hunger, I'm also a little bit concerned that you're not eating, you know? And so that's a lot of times the conversation that you have to have is how to eat more frequently while you're taking one. And that's something that people struggle with because sometimes they're trying to eat the same size meal that they were before. And one of the things that these medications do is, you know, decrease how much you can eat at one time. You fill up really quickly. And so if you're kind of overeating even by a little bit, it's going to be hard to eat the next meal in a reasonable amount of time.
Makes sense. Yeah, it's there's a pretty big middle ground between thinking about food all the time and eating all the time and dropping all the way down to one a day. It's like there's probably a much healthier in between line there.
Right. And that kind of ties into my other one of my other points here, which is that, you know, I think one common mistake for sure is just needlessly increasing the dose. And I know that, you know, the kind of recommended way to prescribe these is to titrate the dose up. They start at like a really low dose, and then they kind of universally increase it to this max dose. But a lot of people are getting, 90% of the benefits with the first dose and are still excited to increase the dose. And I'm thinking, you're there. Maybe you should just stay.
Would you say that's someone that just maybe isn't aware of what a good expectation for like a reasonable amount of weight loss is?
That's part of it. And one other thing I think is a factor is a misunderstanding of how the medication works. Some folks think that there's like a fat burning effect.
Yeah.
And so by increasing the dose, that they're going to burn fat quicker. But truly it's an appetite suppressant. And so if you're already not eating a whole lot, you've made it, and you're not going to get much more benefit from going beyond that.
I mean, I think that's honestly probably the most important point we'll make on the whole episode is it can be helpful for reducing appetite, but it's not doing anything on its own. That's also why you will, like in talking to one of my friends who's also deals with nutrition side of training, she's had multiple people who have actually gained weight on it. Because again, it's not doing it on its own. It's a super helpful aid for a lot of people, but it's not the only thing.
Right. Well, and I think it kind of eases the some of the burden of trying to make these changes, and looking at it like that is way better than thinking getting on this is going to solve my problems.
I'd say amongst personal trainers probably is a bit of a controversial thing here is you always hear the talk about food noise. So how would you describe like an appropriate level of food noise? I think one of the issues is people thinking they should never be thinking about food, and it's like obviously it's part of a healthy human body to occasionally be thinking about food. Right.
Yeah, you're not trying to get rid of that entirely. And I think that's what happens when people just stop eating, and are even like repulsed by food a lot of times. They can't even think the thought of eating makes them feel sick. But remind me what that question was again.
Yeah, I guess how would you describe a healthy level of like food noise?
Yes, and I think there's also other management techniques, but a healthy level of food noise to me is hard to answer, honestly. And it's what the food noise is. Is it like cravings, or is it just that you're looking forward to your next meal? Even that could be kind of a spectrum there.
Yeah.
But one of the things I see with food noise specifically is if you don't know what your next meal is, if you don't have a plan, there's going to be food noise.
Yeah.
And when you're on a GLP-1, you don't have food noise just because you're going to be able to skip that meal if you don't, if you're feeling like it. Whereas if you are going to have to eat because you'll actually be hungry at lunch, but you don't have a plan, your mind's going to wander about what to eat.
True. I think, and that's a good case, again, whether or not someone's on a GLP-1 of like, why you're always going to do better having a plan. One of the things I always tell people when they're going to a restaurant is like, check the damn menu ahead of time. Like, figure out at least what you're most likely going to get. Because when you go in with a plan, you're much less likely to make a bad decision.
Yep.
And again, GLP-1 or not, that's still going to be helpful. I think a lot of times, we see people falling off and falling victims of cravings because they don't know what their actual next thing to eat is. So anything's a potential answer.
Right.
Versus if you're like, well, no, I already have this sandwich for lunch or whatever, it's probably a lot easier to turn something down because you know you have something coming.
Yeah, it's like similar to planning your day even, you know. If you don't have a plan for the day, you could do all sorts of different stuff, and your mind might even wander about that.
True, and get nothing done that you're supposed to get done.
Exactly, yeah.
I think we hear from a lot of like the better places who are diagnosing these is the importance on lifting weights still while they are doing a GLP-1. Can you kind of expand on why that's so important for people on these medications?
That's my second must do here. And, one of the things I like to talk about with this is that you see all these headlines about people just losing incredible amounts of muscle mass while they're taking a GLP-1. And even people coming into my office that are interested in a GLP-1, that'll be kind of their main concern. It's like, but I don't want to lose all my muscle mass. But the studies aren't, they're not on people that are doing strength training. It's just on people that are prescribed a GLP-1. And so just like we were talking, if their nutrition goes to almost nothing, that's the perfect recipe for losing muscle mass.
True.
And so I don't think taking a GLP-1 is like a death sentence for your muscle mass. But you're right, you got to incorporate some strength training. And what I tell people is that it doesn't take all that much strength training, you know. It does if you're trying to build a lot of muscle, right? That requires a lot of volume and frequency. But really, to maintain muscle mass, you can get away with a lot less.
I think from what I remember on this, most of the studies, it's around like 30%. So if you
Yeah.
were, at X level of strength lifting 3 times a week, you can probably maintain that on literally 1 day a week of the same program.
And if you're a beginner,
Oh yeah, even
it's
less,
probably even
yeah.
less.
Yeah,
Yeah.
true.
And so that's, just to kind of help people align their expectations, because sometimes people don't want to do strength training because they see, what they think they're going to have to do, and it's usually not the case. And yeah, they can get away with a lot less. I have some folks that just do squats and push-ups. It's like an alternating thing, but body weight squats and body weight like incline push-ups. And we do the body composition assessments, and that's been pretty good for maintaining a decent amount of muscle mass.
That's awesome. And so then on a similar vein, protein would fall under a similar
Yes.
spot.
And protein's on my must-do because it kind of ties into skipping meals too, right? If you're just eating fewer meals, there's fewer opportunities to have protein. Plus, protein's really filling, and if the GLP-1 has got your appetite at 0, it's going to be really hard to eat more protein. But yes, protein, is like a synergistic effect with the weightlifting for maintaining your muscle mass. And what I tell people is that the strength training is really the priority. It's got to be the most important thing for maintaining muscle mass, and the protein, it kind of plays a supporting role.
For those who aren't always as knowledgeable of like which sources they should use for protein, can you give people your protein equation?
My protein equation. For lean proteins.
Yep.
Yeah. Gosh, sometimes it's hard to just pull it out of my head, but essentially, when people are looking at protein sources, and I work with GLP-1 folks and folks that have had metabolic surgery, and sometimes they'll come in with their food log and they're eating like pork sausage for breakfast is a classic, which has more fat than protein. And so I've been using this kind of recommendation where I'll have people take how much protein is in whatever food it is times 10, and the calories should be lower than that.
Makes sense, yeah.
So if it has 20 grams of protein, it should be 200 calories or less to be considered your lean protein. And so, if you have something that's higher fat, you just have to factor that into the meal. But yeah, I think that's a pretty decent rule of thumb for proteins.
Yeah, I was explaining to someone the other day, it's not that we can't incorporate, say, a higher fat food, but it's like your protein is your main goal first. So it's like we got to prioritize that, and that might mean sacrificing a serving size of something, or using a lower fat version of something to get to that same goal.
Right. Yeah. And it's the course of the whole day that has to balance out. Yeah.
Exactly. Are there any other items on your list that we haven't gone over on your must-dos?
Yes. And they're kind of in addition to the couple that we talked about. But with protein, I think water is the second most important thing. And some people don't realize that, that reduction in their appetite there seems to be a reduction in the thirst. And so people just aren't drinking as much water. So you want to make sure you're doing that. And kind of between your meals, because it's going to be a filling thing too, you might want to space it out from your meals a little bit. But yeah, that's something I think people forget about.
Do you have guidelines for how a person so again, especially if their thirst is giving differing signals, how would you make sure that they're drinking enough?
The one recommendation I always give is just start the day with it.
Yeah.
I think for several reasons. One is that you're increasing the amount of time you're drinking water if you start earlier. Plus, it sets the tone for the day.
It's like college. If you start drinking in the morning, you can drink more.
Yeah. That reminds me of a saying my grandfather had, which was, you can't drink all day if you don't start in the morning.
Exactly. That's probably what I should have said, yeah.
But anyway, same for water. Yeah. And like I said, it sets the tone. If you start your day with water, you're thinking about it, and you're kind of prioritizing it.
Yeah.
And the other thing is with strength training, my other recommendation for physical activity is always the steps.
Yep.
And people get sick of hearing me talk about it at work probably, but
Yeah.
I always say that the amount of steps you take in a day is the most important thing from the exercise side for actually getting your weight to come down. And the strength training plays the role of maintaining the muscle mass so that you're actually losing fat mass.
No, exactly. It's I think a lot of people, especially those who exercise, really overstate how active they are. It's like, yeah, if you got in, a good workout in the morning, but if you're sitting at a desk job and you got in 1,500 steps the rest of the day, you're actually still qualified as an inactive person.
Right.
Like there's a lot more to it than people think on that.
And there's different types of exercise, right? Like strength training is great for building strength and muscle, but it's not walking.
Yep.
And walking isn't strength training. They
Exactly.
both serve their own purpose.
No, that's honestly, again, my wife and I have been a huge fan of this, and I was actually just talking to Joe, is just getting a walking pad can be the simplest thing for that. It's like $100. You can fit them anywhere in your house. And it's amazing how just doing like a 5 or 10 minute walk after each meal really starts to add up. It's because, again, a lot of people tend to be busy and we say we can't fit in, a huge walk during the day. But it's like, well, but can we get in 5 minutes 3 times a day? And that still ends up being like close to a mile of additional walking that you did just that day.
Yeah, and it removes a lot of the like weather factors,
Exactly.
right?
Yeah, as Montanans, that can be a thing.
Yeah, not this year yet, but
No.
yeah, that I'd like to tell people you got to have a plan B for walking in the wintertime because you live here. You know?
Exactly.
One thing I was going to say about those walking pads, I work a desk job, and so getting my steps is kind of difficult, and my watch will give me a little graph. But it's not like I go for one long walk and get all my steps. It's really just kind of small incremental increases throughout the day, and which I think just shows that short walks throughout the day can get the job done.
Oh, for sure. And it's, again, you look at like I'm trying to remember how they define this, but when you look at people who are naturally and like the people who hold a low body weight without like directly exercising, almost all of them have those jobs where they're either constantly moving or they're just someone who just fidgets and does the little things throughout the day as it is. Like,
right.
Obviously, I think it's more beneficial to be doing direct exercise in addition to that, but you can get a lot of the activity benefits just from doing stuff.
And it's a easy place to start. If you're new to exercise, walking could be kind of your foot in the door, so to speak.
One foot in front of the other.
Yeah.
Last question I had for you is just, so if someone's been doing a GLP-1, what would be some signs that they are missing part of the picture? Like, how would they know that they need to be incorporating something that they might be missing?
One might be just, incredible fatigue. And I do see that too, because if you're not eating throughout the day, you're going to feel very, very tired. And sometimes people are confused because they don't have the hunger to go with this fatigue. And so they're like, gosh, I'm just so tired. It's like, well, what have you eaten today? It's usually nothing. And so, that would be a pretty good indicator. Another thing we see is like hair loss, trouble sleeping even. And those can be indicators that you're in just a far too severe calorie deficit.
Which is interesting because you have audience doesn't know this, but you have a background in bodybuilding. Sounds pretty similar to like symptoms that a bodybuilder might have as they approach like a prep or whatever. Yeah.
And actually it's funny how well that kind of experience in my life has helped me with folks that are, trying to lose weight. But the hair loss is such a big concern for people. And I always tell them, if and when you get to like your goal body weight and you're going to maintain that for a while, and your calories come up to kind of support everything your body needs, usually your hair will
come back.
Sprout again.
Just open.
Yeah. And actually, I think I have a couple more things to add.
Go right ahead.
The third common mistake is that I see people that just don't have an exit strategy.
That's a very good point, yeah.
And, a GLP-1, I kind of see debate going back and forth on should these be like lifelong medications or should they be, just temporary. But it seems like, and the research supports this too, is that most people are not on them long term.
Yeah.
It's like in 2 years, most people are off of them again. And so it's really important to think about that, it's coming.
I'd say it's also probably a red flag for whatever provider you're working with. Is probably a question you should ask is, what is my plan for how to titrate off this or to exit plan? Because I did have a client where she's like, oh no, they said I just stopped taking. It's like, that's not a real strategy.
Yeah. And I've seen that where, and sometimes people are taking it and I think they forget what it was like before they were taking it. And they think, this isn't too bad. I think I just do this. They'll just stop cold turkey. And the next time I see them, they're like ravenous. So I think, this kind of goes back to communicating with your provider that's prescribing it, not only on, do I need to jump to the next dose? Maybe I'm good here, because that's, you have say over that. You don't have to increase it.
Mhm.
But also, yeah, what are you going to do on the tail end? Can you taper it? Or, obviously, I don't think it's a good idea to just stop it cold turkey.
Yeah.
And I think sometimes that's due to like financial,
True.
hangups with
Makes
getting it.
sense.
But I think with food, you need an exit strategy too, in just that, if your current plan is to skip all your meals all day and eat one, just remember that the GLP-1 is a reason you can do that.
Mhm.
And if you think you're just going to carry that over to after the GLP-1, it's not going to work out. So use that time when you don't have a lot of hunger to practice, just a decent meal pattern.
Makes sense. Awesome. Well, Mr. Horst, thank you for coming on.
Of course, thanks for having me.
We'll see you guys next episode.